Everybody, welcome back. We are going to talk a little bit about and read a story put out on March 3rd by the CDC saying that they have removed face mask requirements for 90% of Americans. We're going to go ahead and read this news story. Then we're going to call this number right here and ask them why they did it on this date, just to get a bit of a laugh and a chuckle. So let's go ahead and call the CDC and read their article from March 3rd. So they say more than 90% of U.S. population can ditch face masks under CDC COVID-19 guidance. And of course, in the language of gematria, when you write out the word 90, it sums to 33. They do this on March 3rd, 3-3. So this article goes on to say more than 90% of the U.S. population lives in area where they no longer need to wear face masks for the Centers for Disease Control and Prevention said Thursday. The CDC issued new guidance last week that focuses on severe disease from COVID and hospitalizations when making recommendations on whether or not face masks are needed. The guidance is broken into 3 color-coded levels. People in green and yellow counties with low and medium COVID levels, respectively, do not need to wear masks. However, people in yellow counties who are at high risks of severe illness from COVID should consult their physician about whether they should wear a mask or take other precautions. Everyone is still required by federal law, by the way, the word federal is 33, to wear face masks. I think they mean on planes, trains, and other forms of public transportation. The face mask requirement for planes expires on March 18th. CDC officials have said that they are reviewing whether or not the requirement is still necessary. You know what's funny about that? Like, if you were on a plane and you were flying, like, say you were flying from like the U.S. to like Australia, and you were on the plane for 14 hours. Like, if you just got on, like if you got on the plane and the plane was flying from like New York to Melbourne, and you just like, you knew you were going to be on for like 15 hours and you just took your mask off on the plane. Like what could anybody do? Like, would they literally throw you off the plane? Here, just plummet all the way to your death. I mean, what could anybody really do? You know, I often wondered that, like, if you were flying on a plane, you could just you could just wear the mask while you're going through all the security and everything else. And then like, once you board the plane and the plane starts trafficking down the runway, like, you could just take your mask. You could do anything. You know, start like a revolution on the airplane. Oh man, you know what's funny about it too? I always like how they have to color code each county. Oh, here's what you should do based on what your county's color is. We color coded it for you to make it easy for everyone to understand. I mean, that's literally how dumb they think people are. Actually, that's how dumb they know people are, right? So, people in red counties with high COVID levels are recommended to wear masks indoors in public places, regardless of vaccination status. So, what's the point of getting the vaccine? Less than 10% of the U.S. population now lives in such counties, according to the CDC. Well, I mean, if the CDC is telling me, then I know it's true. You can check the status of your county by visiting CDC's website. Yeah, we're not going to do that. The Omicron COVID variant upended the U.S. in December and January, causing unprecedented levels of infection. However, new infections have plummeted now that we're in the year of the tiger, like we said they would, and are down more than 90% from a pandemic record in January. Isn't that kind of funny too? Like how does that happen, right? Like when COVID vaccines first happened, they first introduced the vaccines, COVID cases skyrocket. Now, when we have even more people vaccinated, suddenly they drop 90%. I mean, doesn't that seem like a bit hypocritical? Like before you had the vaccine, you weren't hitting record highs. Then the vaccines hit and we hit record highs. Then just 2 months after the record highs, when more people are vaccinated, they plummet 90%. I mean, does that make any sense to anybody? You know, it just doesn't make any sense, right? The U.S. reported an average of nearly 58,000 new infections on Wednesday, compared to a peak of more than 802,000 on January 15th, according to the CNBC analysis of data from Johns Hopkins University. You know what's interesting about that, right? The 802,000. Think of that. That's kind of a lot like 82, right? Like how the word COVID's 82 and the new COVID pills have the 82 on them. Hospitalizations are down 77% from the peak level during the Omicron wave. More than nearly 35,000 people were hospitalized with COVID on Thursday. You know, in the gematria community, we like to hashtag 35 Thursday, right? 35,000 hospitalized with COVID on a Thursday, down from nearly 153,000. What do we know about that number? And of course, they got to put January 20th on there, right? 201. COVID's got the 82, hospitalization got the 77 in the most pure cipher. So I'm sure that hospitalizations were down 77% from a peak level. 35 Thursday, got the hashtag right here. And of course, we know who's running the show. 153,000 on January 20th, 201, the number of the Jesuits, like the Event 201 coronavirus outbreak simulation. President Joe Biden, in his State of the Union speech Tuesday, said it was safe for most Americans to return to the workplace. You know, and that's funny that anybody would actually listen to Joe Biden, because what Joe Biden said that? Was that the confident Joe Biden who, you know, recited the 666 just so perfectly in his one State of the Union speech? Or was it the senile Joe Biden character that, you know, doesn't know the difference between a boy or a girl, who can't even know what city he's in when he's talking? I'd like to know what form of Joe Biden said that, what Joe Biden character they let say that. With 7% of adult Americans fully vaccinated and hospitalizations down 77%, most Americans can remove their masks, return to work, stay in the classroom, and move forward safely, the president said. You know, it's kind of funny because in the language of gematria, New World Order is 75, Catholic Church is 75, Order Out of Chaos is 75, Order's 75. See, when you know the language they operate by, you just laugh at these articles. You just see it. It's just all number rituals, right? So let's go ahead and let's call the CDC. I'm going to ask, let's ask the CDC. Hang on, somebody just responded on Twitter. Oh, no, okay. Oh, no, that's somebody who's cool. Never mind. I didn't know if that was like a troll or not. Oh, that's funny. That's funny as hell. But all right, let's go ahead. Let's call the CDC. Let's ask them why they decided to do it today. We're going to call this number right here, this 800 number. Here we go. Let's see.
Thank you for calling CDC Info, a service of the Centers for Disease Control and Prevention. If you would like to continue in English, press 1. CDC. To protect yourself from COVID-19, get vaccinated right away. Get a booster if you are eligible, and make sure your COVID-19 vaccination is up to date. COVID-19 vaccination is recommended for everyone ages 5 or older. COVID-19 community levels are a new tool to help you decide what prevention steps you can take based on whether your community has a low, medium, or high level. To protect yourself and others from COVID-19, wear the most protective mask possible that fits well and that you will wear consistently while in indoor public spaces when your community has a high COVID-19 community level. At lower levels, you can still take steps like getting tested if you have symptoms and talking to your healthcare provider if you are at high risk for severe illness. Be sure to stay away from others if you are sick or have been exposed to COVID-19. If you want to order a free at-home test kit, visit covidtest.gov. If you have no or limited internet access and would like to order a test kit, please call 1-800-232-0233. To find a testing site near you, visit hhs.gov/coronavirus/testing. Continue to take all the steps you can to prevent getting and spreading COVID-19 and learn more at cdc.gov/coronavirus. If you are a medical or healthcare professional, press 1. If you are a member of the media, press 2. For all other questions, press 8. To repeat this menu, CDC info representatives give health information and do not diagnose any health conditions. Please listen to the following options before making your selection. If your question is not related to COVID-19, press 3 now. For questions regarding vaccinations for COVID-19, press 4. For questions regarding MAM or the Vaccine Administration Management System, press 8. For all other questions regarding COVID-19, press 0. Please hold for the next available representative. Your call may be monitored or recorded for quality assurance. At the end of the call, please stay on the phone for a brief customer service survey. Thank you for calling CDC Info. My name is Maria. To ensure I provide you with the best resources for your area, may I have your zip code, please?
Yes, it's 16001.
Thank you for that. What can I do to assist you today?
Yes, ma'am. I just have a question regarding a article put out by CNBC on March 3rd. The article was from the CDC, where it says more than 90% of the U.S. population can remove their face masks, according to the CDC. Are you aware of this article on Thursday?
I'm not familiar with the article in question, but there have been new updates for community levels in regards to masking. Would you like me to pull up the community level for your county?
No, that's fine. I just wanted to ask you, do you wonder at all why they did it on Thursday, why they chose it on that day? Because what I found interesting was when the vaccines first went live, they reported in January that we had hit record number of COVID-19 cases and hospitalizations, according to this article. Now, just 2 months later, when even more people have gotten the same vaccine, including several booster shots, the cases have somehow plummeted almost completely irrelevant, down 90%. Does that make a lot of sense?
So you're saying that so the article in question you said was by CNBC on March 3rd?
Correct,
They were
yes.
talking about how when the vaccines went live in January, there was a record number of COVID cases and hospitalizations, and they're stating that now in March, we're at lower numbers, and they're not really reporting the data as they were back in January, and you're wondering why this is.
Yeah, I was just wondering why that is. Like, when the vaccines didn't exist, we didn't hit a record high. Now the vaccines have existed, we hit a record high. Now with more people with the same vaccine, all of a sudden they plummet 90% 2 months later. I mean, does that really seem like that's a real statistic? Like that could really be possible?
I can absolutely pull up that information for you.
Okay.
All right, so we're wanting to know what's the difference between the numbers now, the current numbers, and the numbers back in January.
Yeah, I want to know. I want to know how that's possible, because that seems like a big plummet to me.
Okay, I can assist you today. I do need to take a moment and pull this up in my resources. While I do so, would you mind if I place you on a brief hold?
No, go right ahead.
All right, thank you so much for holding. I'm going to place you on hold now.
I can't believe she's actually. Usually, you never get this far. Oh man. I got to try not to be an ass because she's actually working with me. We might be here a while. must be digging deep into those archives, man. You would think, like, you know, they would have the answer in 2 seconds, considering this is all stuff that they reported. I wonder if they're fudging those numbers at all, perhaps.
Hello, sir.
Yes, hello, ma'am.
Hi, thank you so much for holding. I was able to pull up some resources for you. I'm going to start with, as far as cases, then the period of January 21st, 2021, and the count, overall, the total new cases from that time period until now have been 79,031,738. In the past 7 days, it has been 264 cases. Total deaths since January have been 569. Okay.
Okay.
So that's overall. If you put it in the last 7 days per the count, you're looking at the weekly. As far as hospitalizations are concerned, it says that the prior 7-day average, it was a 30.3% change in the 7-day average. So the total new admissions for the current 7-day average is 4,243.
Okay.
So the current 7-day daily average for February 23rd to March 1st, 2022 was at 4,243. And this is that 30.3% decrease from the prior 7-day average, which was 6,089 from February 16th to February 2022.
Okay.
So the new admissions for hospitalization are pulled at a 10 a.m. Eastern Standard Time snapshot of the HHS Unified Hospital Time Series data sheet, or data set rather, due to the potential reporting delays. Data from the most recent 7 days, as noted in a table that I'm looking at with a gray bar, should be interpreted with caution. There are small shifts in historic data that may also occur due to changes in the Center for Medicare and Medicaid Services, or CMS, provider of the services file, which is used to identify the cohort of included hospitals. So the hospitals have to report the data. This data gets filtered down to us. So that's for hospitalization. As far as the cases reported, it states that as of March 2nd, 2022, the current 7-day moving average of daily new cases, which is 53,017, decreased by 28.5% compared with the previous 7-day moving average, which was 74,143. So a total of 78,977,146 COVID-19 cases have been reported in the United States as of March 2nd, 2022. But these numbers are being reported on a 7-day moving average. So they're going to take the information from the past 7 days and report that. And that is that number that you see change.
Okay. Yeah, that's fine. But one question I have, I appreciate you staying on the phone with me, because a lot of people, when I make these types of calls, they don't do it. But the one question I do have though is these numbers that you're pulling up. Would you say that they're all entirely accurate, or are they just based on what like the media is reporting? Because what's interesting is I had called on my YouTube page. I'd actually made a call to 3 hospitals within the Pittsburgh region in Pennsylvania. And all 3, and I just asked them simple questions. I asked them questions like, how many patients in your hospitals have COVID versus those that don't? How many are vaccinated versus how many that aren't? I asked them if they could release any of that information, and they all said that they couldn't release any of that information or that they didn't know. So my question is, how does a source like the CDC have that information when hospitals can't release that information to anybody?
So, health departments voluntarily share COVID-19 case information with CDC after removing all personal information, such as names, home addresses that can be linked to an individual. CDC compiles and publicly shares these data, which includes COVID-19 cases, the hospitalizations, and deaths. However, the high volume of COVID-19 cases has also strained the reporting capacity of hospitals, healthcare providers, and laboratories in many states. So at this time, not enough jurisdictions provide case hospitalization and death data to the CDC by say vaccination status to produce national or regional estimates on a routine basis. The CDC continues to collaborate with the jurisdictions to help improve the speed, accuracy, and completeness of data shared with the CDC, and the report supports the reporting of cases, hospitalization, and death by vaccination status. Now, there is more information on CDC's process for monitoring COVID-19 cases across the country, as well as collecting and sharing data with the public. I have a link that I can send to you that has like a frequently asked questions on how they do the surveillance, but it is information that's being offered on a voluntary basis. If ever there's any discrepancy in what's reported on the CDC website and what's on what's the word I'm looking for? My brain just stopped. I'm so sorry. The health department website. There we go. If there's a discrepancy on what's reported from CDC and the health department website, what's on the health department website should be considered the most up to date.
Okay. I mean, that all makes sense in that, but well, a lot of what I was just wondering is I don't know if you know about like things like the Event 201 coronavirus outbreak simulation of October 18th, 2019. They ran that simulation. The CDC was a part of it. So was the Bill and Melinda Gates Foundation. So was Klaus Schwab. So was Johns Hopkins University. They ran that simulation the same day the military World Games began in Wuhan, China, 1 month before the outbreak in Wuhan, China. This is something you can actually watch on the internet on YouTube. And what's interesting is the Bill and Melinda Gates Foundation that was a part of that simulation, they're headquartered in Seattle, Washington, and the first case of COVID-19 outside of mainland China in the United States happened to be in Seattle, Washington, and Seattle is in King County, and Corona means crown. And, I was just wondering how a lot of that stuff comes together, because like when you think about Klaus Schwab, he's a Jesuit, and, Donald Trump was Jesuit educated, and Joe Biden's from Jesuit Scranton, Pennsylvania. And Bill and Melinda Gates are responsible for building Jesuit high schools all over the United States. I have to question a lot of the numbers that are reported in this particular article that I'm talking to you about, because I don't want to overwhelm you, because you seem like a nice person who has a shred of common sense. But what's interesting is the reason I bring up the Jesuits is because the language of gematria, I don't know if you know what that is, but it's an ancient practice that codes letters into numbers. And what's interesting in this story, when they say things like hospitalizations were down 77% from the peak level in January, I noticed that in the most pure cipher, the cipher that Manly P. Hall talks about in his book called The Secret Teachings of All Ages, the word hospitalization sums to 77. And that's when you take the alphabetic order, but you apply the rules of numerology, meaning you break every letter down to a single digit. I noticed that hospitalization is 77. I noticed that they reported that there were nearly 35,000 hospitalizations on Thursday. The word Thursday sums to 35. And they said it was down from nearly 153,000 cases on January 20th. And that's a big number with the Jesuits, because when you run the alphabetic order in reverse, the word Jesuit order sums to 153. And January 20th is a date written 201, right? 20/1, 201. 201 is a big number with the Jesuits. The Jesuit order's 201. Jorge Mario Bergoglio, the first publicly Jesuit pope, his birth name's 201. He lives in Suite 201 at the Vatican. There was the Event 201 coronavirus outbreak simulation. The founder of the Jesuits, Ignatius of Loyola, his name's 201. So I just see these same number rituals, because one thing that you'll find out is if you go on the your internet and you type out coronavirus 56 and coronavirus 201, I bet you'll be blown away by how much those numbers have appeared during the time of the coronavirus pandemic. And if you learn gematria, if you go on gematrinator.com and go to the calculator and type in coronavirus and the Jesuit order, you might find some interesting synchronicities with how the news is reporting their information. Because that's one thing I realized about the news, is that numbers seem to be everything. You know, they seem to constantly code the same numbers over and over and over again. And it kind of gets to a point where you got to say, is this stuff all just a coincidence? And again, I could go on for hours, because I've been covering this ever since the pandemic happened. As a matter of fact, I was somebody that lost my job because I didn't want to wear the slave muzzle. I don't see the point of being a healthy person and having to put a diaper on your face and breathe in your own carbon monoxide. I used to work at UPS down in Zelienople, Pennsylvania. So, and then you see like how these children today are being guinea pigs for big pharma, and the CDC, they're going out and they are choosing Pfizer, the most sued company in the history of the world for wrongful death and injury, to be the providers of the vaccine. I mean, shouldn't that be a major red flag to people? I mean, these are things that, I just don't understand. And in light of them choosing 90% of the U.S. population to no longer need the face masks, when you write out the word 90, it sums to 33. And the news broke on March 3rd, the date that's written 3-3. And if you don't know how that cipher works, it's because N's the 14th letter. So 1 + 4 is 5. I is 9. Another N. You got the E, the 5th letter. T, the 20th letter, becomes 2 because 2 + 0 is 2. And then Y, the 25th letter, becomes 7 because 2 + 5 is 7. So when you add it up, it's 33. You see how this works? Like, I got to question a lot of the things that the CDC and these other, enterprises put out, these other media outlets. Because I also work with the media. I also work as a high school football reporter. So I am in the media. I'm not just like some conspiracy theorist that called online. What do you think about how the CDC and the rest of these media, how they report things, and what do you think about the language of gematria? Do you think this is like the dumbest thing you've ever heard, or do you think that there could be some truth to it?
So in regards to my personal opinion on this, I'm unable to provide that to you for my contract. I can only give CDC resources, but I can definitely see how, what's the way that I can put this where I won't violate my contract. There's a rabbit hole there that can be easily get lost in, right? So I definitely hear what you're saying, but what I can tell you in regards to how they're taking care of community level currently they're considering three measures that provide a better picture than what was previously used for the community transmission metric of the current impact of COVID-19, while also serving as clear predictors of how the situation could change. So the new COVID-19 hospital admissions per 100,000 population in the past 7 days, which reflects the amount of severe COVID-19 disease within the community. The percent of staffed inpatient beds occupied by patients with confirmed COVID-19 for a 7-day average is an indicator of local healthcare system usage and remaining capacity to care for patients with other medically important health issues. Then the new COVID-19 cases per 100,000 population in the past 7 days is a signal of anticipated healthcare strain. An increase over a threshold of 200 cases per 100,000 population may forecast increases in new hospitalizations or inpatient beds occupied by COVID-19 patients, and then help communities to implement the prevention strategies accordingly. So these three measures were chosen because one, monitor severe illness and healthcare strain caused by COVID-19. Two, they are available for all counties across the country from data reported at the county level or allocated to the county level from health services areas or HSAs. And then three, are reported frequently enough to inform decisions about recommended prevention strategies in a timely manner. So the data used to inform the COVID-19 community level indicator are available through the U.S. Department of Health and Human Services Unified Hospital Data Surveillance System, or UHDSS, which monitors national and local trends in healthcare system stress, capacity, and then community disease levels for approximately 6,000 hospitals in the United States. So the case incident rate is determined from aggregate counts of COVID-19 cases reported by the state and the territorial jurisdictions to the disease.
Okay, yeah. Again, I know you're doing your job, and I don't want to get you in trouble because you seem like a decent person. But again, it all comes back to what the authority ultimately wants to put out, right? The jurisdiction, the police, the media. I mean, I had a friend of mine who was at the Fred Meyer shooting in Washington State, where he went out and questioned all the police officers about the supposed shooting. He even got to talk to Commander Lee, who was the one that the New York Times and all these major publications were quoting. And Commander Lee even admitted that even he had not been in that Fred Meyer grocery store to witness the shooting for himself. He was just reporting to the police and the media what came through his cell phone. So again, and the whole other reason for my call was that I found it humorous almost that when coronavirus first became a big deal in 2020, because the pandemic was declared. The other interesting thing is, I don't want to sound, like too much of a conspiracy, but when the pandemic was declared March 11th, 2020, that was exactly 666 days after the Clade X pandemic exercise. And what's interesting about that, 666, of course, is the number of the beast. And now, the number of the beast in Revelation is where you got to get the mark of the beast in order to buy or sell, right? You got to get the vaccine in order to, participate in society. Marks one letter off from mask. But the other thing is, when coronavirus first went live, I'm sure you remember this everybody should remember this. They said that the cases, the symptoms of coronavirus were coincidentally the exact same as the common cold and the flu. And then they told you during 2020 that flu cases were down 90% of all numbers, right? While COVID cases were through the roof. And then they told you that coronavirus was the exact same as the flu and common cold, while telling you the flu doesn't exist anymore. What do you think about things like that?
So the coronavirus or novel coronavirus 2019 is different. It comes from the same family. There are many coronaviruses. So it makes sense on some of the information that was put out there. There's a lot of misinformation that's spread about coronavirus and why it's so familiar with, say, the common cold or the flu, because they're all different strands of coronavirus, but they're named different things, right? So let me pull this information up for you. Just a second. I definitely don't want to say anything that does violate my contract, but I understand where this is coming from.
Right. I mean, yeah, exactly. And while you do that, I mean, just think about things too. Like if the government really cared about your health that much, would they take your tax dollars and subsidize junk food so that your supermarkets and grocery stores were full of all this processed garbage full of corn and sugar that causes things like heart disease and obesity? I mean, see, I got to question things like that, you know? And then the children, when they go to school, what are they being served, right? Fruit roll-ups and Doritos, granola bar and Cheetos. You know, maybe they throw a Capri Sun in there for more sugar. I mean, that doesn't seem to really be caring about people's health. Because I'm somebody that eats healthy. I mean, I really only eat vegetables. I don't eat a lot of meat. I don't eat a lot of junk foods. I cut sugar out of my diet. You know, I've been healthy the whole time. So just some things to think about.
And a lot of the symptoms of these coronavirus, they overlap. So
yeah, they overlap. That's my whole point. It's like, you know, when you look at what the flu is and then you look at coronavirus, it's like it's almost the exact same. And then when you do research, you find out that the term coronavirus was coined in 1968 to be a synonym for influenza due to the Hong Kong pandemic. And of course, Hong Kong is in China, just like Wuhan is. I mean, like, what do you think about that? I mean, is that all? Can that just be a conspiracy theory? I mean, that seems like that's way too, you know, I would have a better chance of hitting the lottery than having that be a line up as a coincidence, don't you think?
So as much as I would love to go down this road with you, every time you ask me, what do you think about this? What do you think about this? I can only provide you with the CDC resources in regards to COVID-19.
Okay. Well, you know what? That's fair, ma'am. Again, you seem like a great person. You know, you might want to go when you get home. You might want to check out the website called gematriaeffect.news, because you seem like somebody who has a shred of common sense and you seem like an intelligent person. And I don't want to get you in trouble at your job. So you know what? You have a great rest of your day. I'll let you go right now. And seek truth. Be a truth seeker. Thank you for listening. I appreciate it.
No problem, sir. You have a wonderful day.
All righty, guys. We can probably leave it there. She's somebody that seems like she's got a shred of common sense. So check in with the chat for a minute. I didn't want to go too crazy with her. You got to be careful how you got to be careful. Again, I told her about Event 201 and Clade X, and again, it's going to be up to her to do her due diligence. I mean, hopefully she does. I mean, again, she seemed like, you know, she seemed like she was one of the special ones. She might have had some real knowledge. You know, she might want to. Hopefully she researches that. Hopefully she does it. But you know, again, we can only do so much in this community. I'm surprised they haven't taken this stream down yet. But you know, again, I mean, that's the thing. I mean, I know people like Neo the Hacker was on, and he was talking about how he quit YouTube temporarily. I did see he came back recently saying that nobody cares. But see, you can't have that attitude, guys. You can't have that I quit, you know, to give up attitude. You have to understand that, you know, the information you put out every day or every other day, if it helps to wake up just one new person, you know, that's a win. You know, that's an absolute win. I mean, on Twitter last night, I was scrolling through just seeing how, you know, just seeing how retarded half of the people are. It's like it's I mean, now's the time to stand up, and just real quick before I sign off, for the people on my Patreon that are asking about the NHL and the rituals they've done with the NHL and the Stanley Cup, what we're going to do is toward the end of the regular season, probably once the playoff brackets are decided, probably before the NHL regular season ends, we're going to live stream. I'm probably going to put out a poll on YouTube because I know I have people all across the globe. We're going to try to find some common ground on what could be a good time to do a live stream. I'm going to put my Stanley Cup bracket together. We're going to do an entire live stream. That's all going to happen late April. Of course, I'm going to continue to look at all the day-to-day games and interesting things. I know a lot of people, we had a couple nice upsets last night. So what I'm going to do, that's how I'm going to do it. And we're going to play it. We're going to play it that way till the end of the season. That's probably the best way to go about it. So, yeah, this stream went a lot longer than I wanted it to, but I think we got some good information out there. Hopefully, we got another truth seeker on the phone. Hopefully, she continues to seek truth. But we'll leave it there, guys. I'll talk to everybody soon. Until next time.